Kason Taylor. Today I'll be discussing with you guys a topic on whether or not marijuana is a gateway drug. I personally don't believe this to be so due to lack of research on both ends, but primarily the lack of evidence on the side for it being a gateway drug. Today I'll be giving 3 points as to why it's not, and number one will be why it's not a direct cause, but rather the environmental factors and underlying issues in addiction that give a gateway effect. Next will be the legalization impact and how much percentages have dropped in external crisis towards harsher drugs with the use of marijuana. And third will be how marijuana can be seen as a step back rather than a step forward in the drug web. Part one is how marijuana is not the gateway, but the external factors, the underlying environment around the person growing up, like how accessible the drug is, or mental issues, loneliness. It all ties in to this gateway effect. Now, if you look at these external sources and take them into consideration, you can see that it's not marijuana that's the gateway effect, it's the issues of people making decisions in life. My second point will be on how legalization helps in the world of opioid crisis. Now, the National Institute of Health, coming from an article in 2023, states that legalized marijuana have less opioid prescriptions per year. And this is all around. So if you think about it in correlation, that means marijuana is seen as a safer pain alternative for the patients, at least. This is also backed by the UPMC, the University of Pittsburgh Medical Center, which ran a test on the state, and they experienced a 7.6 drop in opioid crisis in the span of only 6 months. 6 months. So all of this contradicts that marijuana is a gateway drug. It has a harm reduction benefit. Point three is how marijuana can be seen as a step back rather than a step forward in the drug web. Now, Biomed Central uses this research going on right now in opioid replacement therapy. Now, it's not available everywhere, but they are aiming to push this agenda in the future on marijuana being able to be used as a retentive, basically, to help reduce the craving and dependency of other opioids, since marijuana is way less harsh. Now, the American Journal of Drug and Alcohol Association described that users have reported to them that they have relapse reductions with marijuana rather than an urge to try more harsh things. In conclusion, this means that marijuana is not a gateway drug. Today I presented 3 facts as to why it's not a true gateway, and the fact that environment matters at the end of the day and people have their own right of choice, which is tied in with those environmental factors twisting your brain. Second is that legalization has helped to reduce the opioid crisis. So if you think about it, marijuana is a step back, taking a step back rather than moving into a world of harsher drugs. And using marijuana doesn't mean that you will try these harsher drugs. At the end of the day, marijuana should not be labeled a gateway drug because of these facts.